Whenever you're ready, go for it.
I don't want to practice because my voice is horrible. I don't want to hear it back in my head. So,
Okay. Go ahead. Go for it.
this is Sheila Buswell from Buswell Biomedical. You can reach me at buswellbiomedical.com and learn more about our business. You are listening to Vroom Vroom Veer with Jeff Smith, reminding you to follow your intuition and not always listen to other people.
Are you ready to thoughtfully steer away from your revved up, frenzied, and far too often scripted life? Then welcome to Vroom Vroom Veer with Jeff Smith, where he guides you down the road differently traveled by sharing unique experiences with guests who have managed to shift away from a life stuck on cruise control and veered their way into a more authentic and fulfilling one in all sorts of interesting and kind of remarkable ways. Get ready to Vroom Vroom Veer with your differently traveled road chauffeur, Jeff Smith.
Dr. Manan Shah, thank you so much for being on Vroom Vroom Veer and welcome to the show. How's it going?
So excited to be here. Thanks so much for having me.
You don't need to lean into the mic. That's going to hurt your shoulders forever. But thank you for trying.
Just trying to get my voice to sound lower, guys.
You did. It worked. See, it did work. It worked.
Now
great.
It's back to being high pitched, like I got made fun of in middle school for.
It's all good. Don't worry about it. So you are Dr. Manan Shah, and you're at Wyndly.com. That's WYNDLY.com. So talk a little bit about what you're most excited about in your business today.
Yeah. So Wyndly is an online allergy practice. We can help you effectively cure your allergies from the comfort of home. So most people think allergies are this, frustrating thing that happens every spring, and you take a little, Benadryl or Zyrtec or Claritin, and maybe you feel better for 6 hours and you just suffer through it.
Yeah.
I think that we as doctors have done a bad job of letting people realize that you can actually fix your allergies for long term. Just the same way you can get LASIK if you don't want to wear glasses, you can take this thing called immunotherapy. It desensitizes your allergies and it fixes your allergies for long-term relief. That's what we do, and we do it totally virtually. And we're really excited just for the opportunity to give patients access to this kind of care from the comfort of home.
That's awesome. Yes, I want that. Allergies are weird. So let's get into this. So this is Vroom Vroom Veer. It means we have to go back in time and talk about you and your growing up story. So where did you grow up? What part of the country did you grow up? Where in the world did you grow up?
Yeah, I grew up in Maryland,
Okay.
right outside Washington, D.C.
Nice.
And pretty bad allergy season there. But my father was a physician. He was a surgeon, a belly surgeon. And so I always knew I wanted to go to med school.
Gotcha.
I always knew that I wanted to be involved in healthcare. My mom's a dentist.
Okay.
And so I always joke that if a dentist and a surgeon has a baby, an ear, nose, throat doctor is sort of right between, because we're like, we operate right near the mouth. We're like right next to where the dentists live.
Yeah.
But we do bigger surgery than the dentists, or different surgeries than the dentists. I don't want to offend my dental colleagues, but we do more like neck surgery and thyroid surgery and ear surgery, nose.
Okay.
So we're basically right around where we work right hand in hand with our dental colleagues.
Yeah.
And we work right up until where our belly surgeon colleagues start. And so we're sort of literally right between.
Okay. I love it. That's awesome.
Yeah.
So I was going to say, it seems like you and your cousin were kind of like dialed in, at least in the medical world, like from a young age, right?
Yep.
Okay.
Yeah.
Right.
So I have a cousin that is my co-founder of my company.
Right.
And I'm Indian by descent, if you can tell from my name.
Right.
And like most Indian kids, to make my parents proud, I went to medical school and they were very stoked.
Yeah.
And my cousin ended up going down the tech route, which is now very much dominated by the Indian descent and everyone and immigrants too. But he went down the business route. And so, of course, initially he was probably a little bit of a disappointment to his family, because they're like, what are you doing?
What are you doing? Don't do that.
Yeah.
Right. Right.
But he was very good at computers and tech. And as we've seen, as the world has become more and more reliant on technology, it was great to have someone who I knew and trusted and grew up with, who could
speak that language, right?
Who could help me. So like when our office needed a website, I asked him to do something. He was like, dude, I build companies and you're asking me to build a GoDaddy website. And I was like, can you help though? And he was like, yeah.
I can help you find a guy that can do that.
Yeah. But then more and more we started working to like, well, how can we use technology to make this healthcare experience better?
Right.
And so, he started working with my physical office. And then during the pandemic, people were a little bit anxious about coming into physical offices, right?
Totally. Yeah.
Especially in ear, nose, throat, where like the symptoms of COVID and the symptoms of a sinus infection are effectively the same. And so people are like, I don't want to go to a room full of people who have stuffy noses and runny noses.
It's weird that it takes a pandemic for like the medical field to realize they don't have to make people come in. But
exactly. Yeah.
Sorry, and didn't mean to punch him in the nose.
No. And you know what? It's deserved. There was so much sadness and tragedy that came out of the pandemic in so many different ways. But I will say that it definitely, there are a couple things. And I think one of the things that it showed us is that virtual care can provide access, right? It's just an easier way to get access, and having to go sit in my reading room and read like an old copy of Time magazine, sit there for 30 minutes to go to another room and wait for me. Like that is not the only way. Now in ear, nose, throat, that is the only way for a lot of diseases. If I need to look in your ear, unfortunately, you do got to come and sit in my waiting room. And we always put candy in our waiting room, so you can get some snacks. But I got to look in there. I got to put a scope in there, and there's just no good way for me to do that virtually. If I need to look in your throat, I need to put a camera down there. There's just no way to do that.
Sure.
But when we couldn't do that because people were anxious, we were like, well, what can we do that is really just based on history? And allergy was the perfect thing.
Okay.
And so we've been treating all these allergy patients because we had learned as ENTs that if you do surgery on someone's nose to try to help them breathe better, but you don't fix the allergies, the surgery isn't going to work.
Really?
Right? Like you're gonna fix their anatomy, but then they're gonna have all this inflammation and they're gonna be obstructed and they still won't breathe. And so we had all these allergy patients, and they were like, well, do I need to come in? And we were like, actually, you really don't, right? We're not looking in your ears, we're not looking in your nose as much. Let's just do these visits virtually. And so we started doing these virtual visits for allergy. And then some of the parents were like, hey, look, my kid, when he came in, instead of doing the skin prick test, you had given him a blood test. Can you guys just send me that kit so I can do the blood test? So we started doing blood testing. Okay. And so we started mailing people blood testing kits or having them go to a local Quest lab or LabCorp to get their blood drawn and using blood allergy testing. And we just realized that a lot of this process could be done totally virtually or through using like there are local primary care doctors who do the allergy testing, but we end up being the specialist. Okay. We just figured out a way to do it in Colorado that was great. And I think what part of it like made us excited to connect with you guys is a lot of what you guys talk about in your podcast is this idea of like people who are sort of stuck in one way and then something happens and they find a way to veer.
Right.
And so for me, I was kind of stuck as a physician in this healthcare system that is largely driven by the large insurers, right? And so it always felt like I'd grown up wanting to be a physician. It was what I dreamed about doing since I was a kid. And it felt to me like there was always a third person in the room with me and my patients that was really controlling what I could do. And it was their insurance company. Right. And for many situations, I think that
invisible giant that's
exactly.
There,
and so, exactly. So someone would come to me and they'd be like, hey, I want to get allergy tested. And I'd be like, awesome, let's do it. And they'd be like, well, what does it cost? And I'd say, I have no idea because I hire some team to do a contract with your insurance company and the insurance company has a random payment and it depends on your deductible and your copay. And there was just all this confusion. Yeah. And when I was trying to explain this to my cousin who worked in tech, he was like, yeah, that is nonsense. Like he was like, in tech, we tell people this is what it costs. And if they're willing to pay it, then they pay it. And we're so clear and it's just easier. There's expectations and then there's a value prop and we couldn't do that in healthcare. And so as we started doing these virtual visits during the pandemic, patients really loved it. And they were like, I'm never coming back to your office again. Now that you've shown me I can do my allergy treatment totally via Zoom, like, why am I going to drive down to, and in Denver, people were driving down from the mountains to see us, right? Because our practice is on the edge. It's sort of in between Denver and the mountains. Okay. So people will be driving like 45 minutes to an hour. Some people are driving down from Aspen and Vail and hitting traffic. And they were like, I can just see you on Zoom and you can mail me my meds. And we were like, well, for allergies, yes. Now, if you have a thyroid cancer, you still got to come in.
Right.
For allergies, we can do this totally virtually. Nice. And people loved it. It was just like an incredible experience. And so I started talking to my cousin. I was like, look, people love doing this, but we're using Zoom and Google Hangout. Like we just didn't know how to do this in a operational way. I tell people all the time, I'm really good at three things, which is surgery on the ear, nose, and throat and taking care of your ear, nose, and throat and your allergies. Right. I don't know how to use a computer the way my cousin does. And so I was like, how do we make this easy? How do we make them able to sign in their appointments and get their reminders and get tracking numbers and make sure they know when their meds are coming? And so he came and he built this for us locally. And it was a really fun experience. And once we started locally, we realized like, I guess if I can see somebody in Vail via Zoom, I can see somebody in California. right? Like, what's the difference?
Right.
Now, of course, there's legal stuff that we had to work out and we had to pay lawyers, and there's medical licensing in each state, and there's all sorts of nuance and regulations. But once we started figuring that out, we realized like we could probably provide access to people around the country. Yeah. And we just like started reaching out to people. And we realized like in the Midwest, people live in rural areas where the nearest allergist is going to be an hour and a half away. How are they to see that person?
I know. Yeah, I grew up in Michigan. I know what you're talking about.
Exactly. And then we actually found alternatively, there's places like New York City where there's an allergist in, down the block from you, but you're super busy, and to like have to try to like drive there and go there in your busy life and take your kid out of school and meet, like that's also inconvenient. And so we found these patients that were sort of interested in working with us from both like a city perspective and a rural perspective. And we realized, again, what we were providing is convenience and access to high quality care. And so, yeah, it was really fun. And I think from, your guys' podcast standpoint, I think for me, it was really fun because the first thing that happened is halfway through doing this, my cousin looked into trying to do it through insurance. And he was like, we may do that in 10 years, but we're not doing it today. And I kind of freaked out. It's like, how can you provide healthcare without insurance? It doesn't make any sense. Like patients aren't going to understand. And he was like, here's what I want you to do. Think of all the things you wish you could do for patients that you can't because of the way their insurance is set up. And I was like, yeah, it's awful. And he was like, well, what if we just didn't do that? And so now, like, we're not trying to do like a 5-minute visit where we're rushing you in and out. We have time to talk to our patients. And we don't have to see a million patients to make up in volume, because the insurance company's reimbursements drop every year. We just charge people an appropriate, fair price.
Something they're willing to pay.
Yeah, they're willing to pay.
Yeah.
And then we can make the service as incredible as we want, because we wanted to have a concierge who was just like there all the time. And my physical practice could never afford that because insurance companies pay us I think $60 to $70 per visit. We just couldn't afford the economics of having a human being, do that all the time. But now we just charge an appropriate price at Wyndly. We charge $100 a month. And that allows us to have literally a concierge person who's on staff, and across those patients, she's there to answer. And when patients have questions or patients have a problem with the refill or their medication got lost or whatever, they can literally just call her or text her.
Wow.
And so these are the types of things that's been really fun for me, because I think we're in a phase of healthcare in the United States where a lot of physicians are beginning to become burned out, and they just feel like they're just being ground down by the hospital system or by the insurance company or by lowering reimbursements. And then from a public side, everyone's saying doctors are bad people, they make too much money. And so it just feels like physicians are getting squeezed from both sides. And so this idea of hey, I'm going to just disconnect from that broken system and create a system where I just get to take care of my patients and I work directly with them, and I hope I do a great job for them. And if I don't, they're going to give me feedback, and we can just work together to try to get you healthy. And it sort of takes all these other people's incentives out of it.
I love that. And it makes it easy, right? It makes it simple, but there was some innovation going on here. It didn't just start there, right? I remember my brother told me that he went in to see a doctor so many times to get these needle injections. First, he had to figure out what his allergy was. And then the treatment was you had to go in a million times.
Yes.
And then get shots. So I have a needle phobia. So I'm I'm right out. Because I'm going to pass out every time, right?
And so look, the traditional method of desensitizing someone to allergies is what we call allergy shots. Is a once or twice or maybe even 3 times a week shot that you take for months.
Yeah.
You wait 30 minutes after each shot in the office to make sure you don't have a bad reaction.
Right.
And it's 3 to 5
years.
There
for a long time every visit.
30 minutes times 2, so an hour each week, plus the commute, plus the wait time to get. It's just it's a thing. And here's the thing: for some people, it's incredible. If you live next to an office and you've got good insurance, it's a great treatment, and we offer it at our physical office.
I'm not saying it doesn't work, but
but it's a hard sell in today's world because people are just busier nowadays, and people I think people value their time more. People are like, "Wait, you want me to come in a doctor's office how many times a week? No thanks."
Right.
So. Guys, in Europe, there is a treatment called sublingual immunotherapy that dominates the market. It is where you take these drops under the tongue, and they are the same medication as allergy shots, but they provide you with a small dose of what you're allergic to. So if it's cedar, it's a small dose of cedar. You take it under the tongue every day at home. over the course of time, as your body's exposed, you become desensitized.
Right.
That is done everywhere else in the world except for the United States. And the reason
Really?
is
You still
because
can't do it here.
well, you can do it here, but it's
Oh,
not as common. And the reason is because, listen, the insurance company reimburses me and my colleagues for you coming in for a shot. That's like a medical procedure. You can do it. There's a code
gotcha.
for that. We can
Right.
get paid for it.
It's a
The
billing thing.
insurance, yeah, but the insurance company doesn't pay us to give you a drop that you take it home. We don't make any money off that. And so
Right. Okay.
it is hard for us to, it is hard in a insurance-based system for your doctor to offer that.
Gotcha.
And
Okay. Because
it's
of
sort of like,
insurance.
because insurance. And I was
Right.
like, that is the silliest reason
It
to
is.
make someone
It
get
is.
an
It's
injection
silly.
in their arm
Right.
every day for 5 years. Now,
Right.
there are some people shots are the only thing that work for them. By all means, great.
Right.
But for the large majority of people, the 80 million Americans who have environmental allergies, wouldn't it be easier if you just take this med at home? You just like take a drop on the tongue every day. It's almost like a supplement. You brush your
Right.
teeth, you take your drops, you go downstairs, you have your coffee, the day's over, and over time your allergies start to go away. That is what we wanted to offer. That's the dream that we had, and we wanted to offer it to everybody in the country.
Okay.
And we are on our way there. We're in all 50 states, and we have doctors across the country. And it's been a really cool journey because it's taken me from like, hey, I can help a couple people in this local area in Denver, and I can do it, but I have, but I'm hamstrung by what United Healthcare decides to pay. And I'm not saying United's, everyone has their own opinions on them. I think that the system is set up in a weird, complicated way, and everyone's trying to work in their best manner.
Right.
But it's not really freeing for the doctor or the patient.
Right. Right. It's
At
not
Wyndly,
ideal. Yeah.
Yeah. At Wyndly, we give you the opportunity to just work with your doctor, get your medications, feel better, and you do it from home, which
Right.
it's almost like everybody I give them that option, they decide on doing it that way. There's certainly some people for economic reasons that are interested in doing shots, and there's some medical things like bee sting and venom that you have to do via shot.
Okay.
But again, for the majority of patients, sublingual immunotherapy makes sense. That's why it makes sense in the rest of the world. That's literally why they all do it and we don't.
Someday.
Yeah, well, my hope is we are on a
will
mission
get there.
to give everyone
Yeah.
there.
Yeah. We'll get there. So, like you said that I saw in your stuff that you had an allergy to cats.
Oh, yeah,
Talk
yeah.
a little bit about your experience with allergy
Yeah.
to cats.
So part of the reason that I'm so interested in this is because this happened to me. So when you want to be a surgeon, you have to go through undergraduate, you become pre-med.
Right.
If anyone's in college, they kind of know those nerdy kids who are pre-med. While everyone else is out having fun on Saturday, we're home studying in the library.
Right.
Then you go to medical school, and that's 4 years of getting your degree to become a physician.
Right.
And that's a great time. You learn so much stuff. It's awesome. But many of us then choose to specialize, and the specialization then takes another amount of time. So for me to become a head and neck surgeon, it's another 5 years.
Wow. My
Yeah.
goodness.
So and typically, not everyone, but many people like to get into those specialty programs, it's very competitive. And so it really helps to have done research. So I actually took a year off between medical school and my training to do clinical and science research, just so I could show that I was so committed to the field and also that I added to the knowledge base in the field, right? I did research on hearing cells and hair loss.
Wow.
So you're kind of in training for your whole up until you're about 30, right?
Wow.
And it's a really fun time in life. It's tough, it's busy, you're not paid much, but it's really fun because you just get to learn, and you're getting to learn something you're passionate about. But that specialty training is really intense. It is 5 years of working, hundreds of hours a week. And theoretically, there are these limits to how many hours you're supposed to work as a doctor. But truthfully, we all break them and we all just like work, hours and hours and hours and hours in the hospital.
Right.
And it was at this time that I realized I had a terrible cat allergy. And of course, I realized this because I was seeing a woman who's now my wife, who I loved. And unfortunately, she loved cats more than me. And, and I recognized that cats and I were not going to be friends. And the way this happened is she's from Massachusetts, beautiful woman, great family. But, I'm like this Indian kid from Maryland. And so I'm trying to make a good impression at her parents' house. And we're going over there for dinner. And the cats have passed away. And we always knew I was a little bit allergic, but I of course was like, it's not a big deal. And the cats were gone. But it's cold, it's Massachusetts. I use a blanket that the cats had spent a lot of time on, and I end up having a wild allergy reaction. I end up going to the ER, get treated. Wow. It's a whole scary thing. Wow. And that is not common for the listeners. Like, it's not common for cat allergies to be this bad, but but humans have a variability in the reactions. Yeah. I just happened to be the one who had a really bad reaction.
Wow.
And it was scary. And I remember like her father was freaked out. She was terrified. My eyes were all swollen. I was having trouble breathing. It was just like a really crazy, intense reaction. And probably it's because I just like ignored it and kept thinking, oh, I'll just keep hanging out with cats. Yeah. And eventually, you know, sometimes allergy reactions and some patients almost feel like they can get worse. And so that was when I realized I needed to get treatment, but I couldn't get treatment because I was so busy with my own medical training.
Yeah,
I just didn't have the time
forever. Yeah.
Yeah, I just didn't have the time to go take an hour off a week to go get a shot.
Right.
But I was at a university and there was a researcher and a bunch of great mentors and other private physicians who were like, hey, like this is a thing that we do. It's usually done in Europe, but we also do it in our practice. And some of the private practice guys did that. Some of the academic guys did it. And they were like, you can just do it this way. And so I ended up putting myself through an immunotherapy program for cats, which is now what we do in our practice.
Wow.
And
wow.
It was awesome. And now I can go be around cats. Actually, we were in LA a couple weeks ago and stayed at a friend of mine's house with cats. The cat came in the bedroom. The cat was up and down the bed. No issues. And so this was like a life-changing experience for me. And I was trying to realize like, why is this not, you know, even in medicine, I hadn't been exposed to it. And I realized it was mostly just due to reimbursement. And so that was why we kind of made this decision of when we started our physical practice here in Denver, we wanted to offer this to patients. And we started learning, like initially we were like, I don't think people are going to sign up for it. But because everyone's insurance plan is like a high deductible plan these days, everyone has like a $4,000 deductible. We realized like it was probably cheaper for patients to pay for this out of pocket than to try to hit their deductible every year, you know, and pay like $12,000 over the course of 3 to 5 years.
Wow.
And so it really took off in our physical practice and then started taking off, you know, here in Denver. And then now it's been a really cool journey for us to do this. And then from a personal standpoint, it's been really fun for me to sort of, you know, we still have a physical practice. And of course, if you have head and neck cancer or thyroid cancer, we always use insurance. I can't imagine a world where I could charge somebody out of pocket for that kind of a hospital stay. But for this, but for this specific disease process, which is so common and everybody knows someone with allergies, we're able to offer it to you for cash, and patients have loved the experience. And we can give patients the kind of experience that we wish we could give everywhere, but we just, you know, the economics don't make sense in a physical practice, but they do when it's just a cash pay practice.
You know, allergies are weird. That's just Jeff talking. I mean, it's your job, but to me, they're like strange in a way where like I was in the Air Force for 20 years, right? Yeah. And I grew up and there were cats in the house, right? Cats at friends' house, cats everywhere, no allergies, right? No allergies. And then flash forward, I'm in England, right? I get a new boss. He gets this old English house, you know, and it just so happens that he's got this cat and I'm hanging out in his house and I'm like, just like eyes watering, you know, face swollen. And I'm having the full blown allergy reaction, you know, and I'm like, what the hell's going on? I have to leave your house. And the only thing we could think of was cats. Right. Yeah. I'm like, what is it about these damn cats that no other cat on the planet makes me sneeze? You know, so
allergies are weird.
Allergies are weird, you know, and it never happened outside of England.
That's wild.
Yeah.
And so it could have been a breed. Yeah. It could have been something else. Could have been the breed.
Right.
The interesting thing is, again, when you're young, your immune system is effectively sampling the world and trying to decide what's good, what's bad.
Right.
And so we found that people who grew up in rural areas who were exposed at a young age to animals and flowers and trees, their immune system learns like, hey, these things aren't scary.
Okay.
But there's something about the way that we're kind of growing up these days in the Western world where we're not getting that exposure to nature that we used to have.
We're
not getting that time outside, right? We spend our time inside under fluorescent lights. And so what ends up happening is our immune system gets confused and it starts to think something like a tree is something scary or bad. Right. But that doesn't make any sense. And so our thought is, what if you could go back? What if you could give people a little bit of exposure to nature every day in an easy way and let their immune system get retrained? That is the idea behind immunotherapy. And it's sort of my idea behind, you know, part of why we moved to Denver, right? I grew up in Maryland. We are now in Denver. We wanted to be in a place where we were outside all the time, where our kids, like we, you know, I tell people, hey, you should spend time outside and you should take immunotherapy and retrain your immune system. But I was living in this big city in DC and it was a great city. But halfway through this, we just moved to Denver because we wanted to be in a place where the social scene was to be outside, where our activities was to be outside, where we were in the mountains, where our kids were running around every weekend in the woods and
you get
doing
that
all sorts
natural
of stuff.
exposure, but you're also
Exactly.
going to, that's actually a good idea. So
Yeah.
let's talk about like how did you get into the Y Combinator?
Yeah.
Because
So
that in and of itself sounds like an amazing story. Like
it was such a fun thing.
and
so
doing it, that sounds like fun.
So we started building this out of, in Denver, and it was doing great. And we just saw this incredible demand, right? I think we put up like a Reddit post that was just like, hey, if we could do this virtually, would anybody be interested? And we got tons of responses. I mean, all these people came out of the woodwork and were like, yes, I've been looking for someone to do this virtually, but every doctor wants me to go in and pay hundreds of dollars to get tested and go do visits.
Right.
And so we sort of realized, we're like, oh, there's a demand. People want this. And we can offer it to them in a really good way. And so as we started trying to do this past Denver, I immediately realized, like, in medicine, there are some businesses where you can move fast and break things. Medicine is not one of those businesses, right? I spent, as I told you guys, I spent 10 years getting my medical license. The last thing I wanted to do was anger a state license. Was to mess with the state medical board and risk losing my medical license.
Right.
And so then we were like, okay, we're gonna have to hire lawyers. And when you start hiring lawyers to make sure you're doing everything right, man, it gets real expensive real quick.
Sure.
And so we realized, like, okay, we want to go through and have someone who can help us. We wanted to be in a community of people who had built these businesses before, so we could learn from other people. Because we realized, like, hey, there's a lot of other telehealth companies. There's Hims, there's Roman, there's people selling Viagra online, there's people doing sleep online, there's people doing menopause online. There's got to be a place where we can learn from other people who've done something similar,
right,
and try to basically accelerate what we're doing by using other people's learnings. And that's effectively what Y Combinator is. It's a startup accelerator. It's a place where really motivated people go, and they put you in a crew, and you effectively, while you're building your company, every week you guys meet and you tell people, here's what I'm going to get done this week. And the next week, if you don't get it done, it's incredibly embarrassing, because these are like incredibly brilliant people who are doubling their company's revenue in a week, and you haven't done anything. And so just being in that almost like
pressure
it's
cooker.
Like being in a pressure cooker of people helps you build faster. And it also helps you learn from other people, because everyone's solving the same. Every business has a couple of problems, right? They need to find customers. They need to have a system in place to make sure the customers have a good experience, and they need a way to make money so they can continue to provide that service for customers. And this is something, like, as a doctor, we're never taught, right? I'm just taught to do surgery. And I'm not, like, in medicine, we feel uncomfortable talking about money, right? Because it feels like it shouldn't be part of the conversation.
That's insurance's job.
Exactly. And I think in some ways that's true. It shouldn't be. I shouldn't be trying to sell you on something. I should be trying to solve your problem.
Right.
But learning how to build this business so that we could be sustainable was awesome. So my cousin, who's my co-founder, was basically like, look, if we're going to do any accelerator, the only one that's worth doing is Y Combinator does. It's the biggest one. They've built all the big companies.
Yes.
Airbnb, Coinbase, DoorDash, Stripe, like all these massive billion-dollar companies. And so we were like, we should work, if we're going to have to give a little piece of our company to somebody, we should work with the experts. And so we end up applying to YC's like startup school. It was like a thing. They were like, hey, just like go through this process. It'll help you think through your business and create a business plan. And if we like you guys, maybe you'll get, we'll discount your application. And so we end up, or there's something about this. So we did it just as just a trial. We were like, let's just play around with it. Yeah. See what happens. And then we built this business plan, and my cousin was like, hey, I'm going to submit. And I was like, whatever, man. Like, there's probably like, I think there's 32,000. Right. Yeah, there's 32,000 people that submitted the year we were, and they're going to take like 300. I was like, there's no chance they're going to take us. Right. And then we get this email in the middle of the night one night that's like, hey, we'd love to interview you. And I just remember being like, wait a second, what? It was like Michael Siebel is going to be on the email. This is like this brilliant guy who started Twitch and all these like, just these guys who run YC and have built companies that are incredible. And now I get to have a Zoom call with him. And so again, we were like, look, we're probably not going to get in, but we know we're going to build a massive business. Let's just go tell them about it. And we got in there, and I think they just wanted to make sure that we were committed to doing a good job. And so what was interesting, they had people on there asking us a ton of FDA questions and a ton of like healthcare regulatory questions. Because I think YC's argument is like, we can help you make sure you're a big business, but are you guys ethical? they're trying to weed out the next Theranos, right? They're like, we don't want an Elizabeth Holmes on our roster. And so they're asking me all these medical questions. But, and suddenly I was like,
all kinds of stories out there now about like bad doctors. Oh my God.
Exactly. And so they're asking me, they're like pushing me with all these medical questions. And they had this woman, Surbi Sarna, who's like an incredible healthcare founder, just like drilling me. And it was funny because I was so scared about business questions because I'll be honest, that wasn't my strength at that time. I feel like I've learned a lot since we started, but
you're
I didn't know a ton
in the right place. Your heart's in the right place. It's like, I know doctor stuff.
And this is where it's, I was like, oh, you want me to talk about medicine? I can talk to you for hours. I've spent 10 years in the healthcare system. This is all I know. And so we had one interview and then they sent us an email and like, we've got more questions, and we did another interview, and then they were just like, cool, it's time. And so they give you a little bit of funding to help start the business, which is really great. Cause we have a young family and we have a practice, and we didn't have all this to like build this out in a brilliant, beautiful way that we envisioned. They give you a little funding, but I would say the most important thing they give you is mentorship. They put you with these mentors who started incredible companies, and you just sit there every week. And I would say the most wonderful thing about YC is they are kind, but they are not fake nice, in the sense that they are good people, but they will hold you accountable to really, really big, ambitious goals. And if you don't hit them the next week, they're going to be like, cool, you didn't hit them. Are you disappointed? And it's like such a great motivating factor. So we were able to take Wyndly from being a company that was in one state to being in 50 states over the course of like 3 to 6 months. Wow. And part of that's just we needed to learn how to do that. We were able to grow our doctors, and then we were able to make a product that we felt was safe and an experience that we knew was going to give patients an incredible experience. And I think we've tried to keep that ethos, that idea of like, how can we get better each week in the 3 years we've had the company. And it's been great. We've now worked with thousands of patients across the country. We've had patients graduate our program, because immunotherapy is about 3 years. Wow. So we started in 2021. We're now at the point where
people are patients cured, basically.
Exactly.
And if you have like really annoying allergies, that's just something that like you didn't even think was possible.
Yeah.
Right.
It was just really great. So it's been a really fun experience. And now we're hearing just these really fun stories. Like, there was a kid who couldn't stay at grandma's house because grandma had a cat and she had a cat allergy.
Right.
And now the mom is texting. She's like, I can drop my kid off at grandma's house.
Yeah.
And the other thing that's been great is we've also, look, this is healthcare. Things don't work 100% of the time. We've also had the experience of patients who've invested and tried to work with us and it didn't work out for them. And that is also frustrating, but how we've chosen to work with those patients, how we've chosen to be honest with them and tell them like, hey, you're not responding. We need to. So now we have systems in place that try to catch patients who are not responding early. So we can shuttle them back to the traditional healthcare system and say, hey, you're not a good fit for our candidacy or our program.
Right.
And so I think it's just
going to get better as you go. Like screen at the front. Yeah. And I think, well, I've experienced this at different levels. It's not an allergy, but I had this thing. They ended up calling it atopic dermatitis. But they didn't have that name like 12 years ago or 15 years ago. Like they looked at it and they were like fungus, dry skin. Like I went through so many doctors. I got tired of it. Right. I just stopped going. I was like, well, I guess I'm on my own, And then right before lockdown, my parents came out to see me in Vegas from Michigan.
Yeah.
And my mom looked at my leg and she's like, you got to get that looked at. That's gross.
That's not normal. Yeah.
Well, I knew that already. Right. And I had been in the ER for like, infections, right? It's not good. You just can't stop scratching. Right. Yeah. So I knew I had to do something. I was just so exhausted from the system, And finally I found this dermatologist that he literally, like, I'm in his office, like, and he looks at it and goes, I know what that is, and I'm like, oh, thank God. Right. And he gives me this sheet of paper and it's like, this is what to do. And, oh, by the way, you probably don't need a prescription, but here's one anyway. Just do what this says on this sheet. Right.
That's so cool.
One appointment, I'm done. I'm like, thank you. Where were you 15 years ago?
Yeah. Why did you take so much time?
But I get it. It's practice, and we judge it a little too harshly, when we're suffering.
Awesome.
So, okay. So this has been a blast. So let's talk a little bit about how folks can get in touch with Manan, Dr. Manan.
Dr. Manan Shah, yeah. So
Manan Shah.
So one, I'm always happy to talk to other entrepreneurs or people who are trying to sort of go do that Vroom Vroom Veer, like people who are interested in pivoting. I think specifically in healthcare.
Right.
We don't do a good enough job for people in the healthcare field, whether you're a nurse practitioner or a PA or a physician or a primary care doctor or anyone, of helping people realize there are other ways you can veer in your life and build something that you're proud of and that maybe gets you out of the system that wasn't working for you.
Right.
So one, I'm always happy to talk to people like that. And then two, of course, everybody knows people that have allergies. And I think everybody should stop taking antihistamines constantly and just try taking immunotherapy and fix the problem. Right. And so if anyone family, friend, kid has allergies, or if they're doing allergy shots and it's just painful and they want to switch over, you can find us at Wyndly.com. And the idea is like, we chose Wyndly, this idea of like, we wanted people to breathe freely, right? Like breathe like the wind, just have good, and of course I'm stuffy, so it doesn't sound good, but we wanted that good airway breathing. Because that's part of what we are as ENTs. We are here to help you live better, sleep better, and feel better and breathe better. And so Wyndly is WYNDLY.com,
right.
WYNDLY.com. Or if you search for Dr. Manan, Manan, last name Shah, SHAH, and ear, nose, throat, or allergy drops, you'll find us. We're everywhere.
So you can get the allergy drops now.
Yeah. So we are in all 50 states. We have a really easy process. You come to our website, you order a consultation with one of our providers. They sit with you. It's a synchronous visit. It's video. It's just like this. We listen to your story. We figure out if this is actually a good program for you. Right. And if you're a good candidate. And if you are, we order an allergy test and then we'll get those results and we'll prescribe you immunotherapy based off your specific allergy results, right? So it's like, you can't be on the same medication as I can. I needed cats. Maybe you need cedar and dog, but we personalize it to you. And then we send you your medication and we work with you the entire way. You have unlimited visits with our doctors. You have a concierge. You have someone who's just there to help you get through the process and hopefully help you feeling better.
That sounds awesome.
Yeah.
If I still had my thing, I would be paying for that, I think. When you're suffering, it's worth it to pay out of pocket for sure.
Absolutely. Yeah. And honestly, what we found
is not much more than copays probably. Anyway.
It's probably cheaper. Most people have a $20, $25 copay. If they're getting a shot or 2 shots a week, man, like $100 a month, it's way cheaper. And the time and the convenience and not having to get a needle. Right. It's a great program.
Ugh, needles. Dr. Shah, this has been a blast. Thank you so much.
Yeah, well, thank you so much.
All right. You have a good one.
Thanks for taking the time to ride along with us on another episode of Vroom Vroom Veer. For podcast info and show notes, be sure to head over to vvveer.com. That's VVER.com. Man, that's fun to say. And we'll catch up with you next time here on Vroom Vroom Veer.